Good morning, everybody. I'm going to introduce our speakers here in a few moments, but let me begin, if I might, and tell you why we are here today. First, I do want to say I'm joined by the chair of the Legislative Mental Health Caucus, Jim Bell, who you will hear from in a few minutes, and thank you, Jim, for all of your leadership. I'm Darrell Steinberg. I'm the President Pro Tem of the Senate and the author of Proposition 63, the Mental Health Services Act from 2004. I want to begin this morning with three things: Newtown, Nevada, and the Ninth Circuit. Newtown, Nevada, and the Ninth Circuit. Mental health has gotten its fair share of attention over the last several months, not only in California, but throughout the country. And there is a story that we all hear as legislators, as community leaders, as medical professionals, as mental health workers. There are stories that we hear too often. The stories are invariably heartbreaking and often tragic. And here's how it often goes. People with severe mental illness being delivered to an overcrowded emergency room by law enforcement or a family member. When it happens enough times, and that same person ends up in the criminal justice system. When they inevitably leave the jail or the prison, the cycle repeats itself. And then there is the terrible Nevada story. Yes, California should be proud of what it's done and what it does, but what we haven't talked enough about is the fact that the single best social service agency in Sacramento had no capacity on the mental health side to help this individual, James Coy Brown. How many more sad stories must we hear? With Newtown, Nevada, and the Ninth Circuit, it is time for action. Our Proposition 63 is generating $1 billion or so per year. It's the system we need, and it's the system that we want, focused on prevention and early intervention, with most of the money going for people with the most severe mental illness to give them whatever it takes to help them get better. But during the same period of time that those dollars have grown, we have lost about $700 million per year from the pre-existing funding that existed prior to Proposition 63. So today, my colleagues and I propose three significant advances for California's system of mental health care. Number one, we propose the construction or leasing of 2,000 crisis residential beds outside of hospitals for people living with severe mental illness. The purpose of the construction or leasing of these beds is to provide a safe place for people to have the opportunity to become stable. Secondly, we propose 25 mobile crisis units and 200 triage workers. These are people trained to get people in the midst of a serious mental health episode to emergency rooms. Trained to get people from emergency rooms, from jails, and from social service facilities to assess them, to find a bed, to refer them to the right level of service, and to case manage people until that person gets to the level of service they need, either within or outside a Prop 63 program. Number three, we propose a significant expansion of the so-called ISMIP program, which is Integrated Services for Mentally Ill Parolees. This is the whatever it takes integrated service approach for people who leave the prison system or the jail system now and are on parole. Why do we propose an expansion? And I propose an expansion from serving 1,500 parolees to 5,000 parolees per year. 3 years ago, the legislature created the ISMIP program. Since then, 1,502 individuals have been enrolled in the program. Only 359, or 24%, were reincarcerated or arrested. This is in contrast to the estimated recidivism rate for other parolees with severe mental illness of over 71%. 71% to 24%. And the difference being the whatever it takes approach to help people living with mental illness get the housing they need, the psychiatric services, the counseling, the vocational assistance, whatever it takes. How will we pay for all of these expanded services? The crisis mobilization beds, the triage workers, the mobile outreach services, and the expansion of ISMIP. Recognize first a couple of things. Number one, through the implementation of the Affordable Care Act, we have the opportunity to sign more people up for health coverage, and we will do so through these workers, through the triage, through the crisis stabilization, through the ISMIP program, and immediately qualify for a 50% match, or in the case of the so-called newly eligible, 100% match until 2017. Depending upon the May revision, we will look at the status of the Prop 63 fund statewide and seek to access those funds. We are working with the California Endowment, who agreed to put forward millions of dollars already to help match some of what the state puts up to fund triage workers and to be able to help people access mental health funds. And finally, depending upon the May revision, and depending if there is any additional money, we will not hesitate to suggest a modest amount of general fund support for these services. And let me state the obvious, and you know how I'm going to end this. We are paying already, and we are paying big time. Our current system is a budget buster. Also is inhumane. These programs, reducing recidivism, keeping people out of the jails, may or may not satisfy the 3-judge panel. But it's a heck of a lot better to put real resources into keeping people out of these systems, whether they be emergency rooms, jails, or prisons, than what it would cost to try to do anything else to deal with the crisis. And the crisis exists on many, many fronts. To hear a little bit more about what we're talking about and what the real life experience is for those in the field and those living with mental illness, let me begin to introduce you to some of our speakers. Steve Fields, who is the executive director of the Progress Foundation in San Francisco, who has for 35 years been working on the crisis residential issue. Steve?
Thank you, Senator Steinberg. I just want to say on behalf of the mental health community, we want to thank the Senator for his incredible visionary leadership in the area of mental health over the time he served in the legislature. And this proposal is just another step in that process. It's a complicated, difficult field to work in, but we're making progress. Prop 63 being significant nationally and internationally as a way to start to take the steps we need to take to create a community mental health system that's separate from our institutional mental health system that we tried to divest ourselves of so long ago. Progress Foundation in San Francisco, Napa, and Sonoma counties has operated crisis residential programs for 35 years. The purpose of these programs is to fill another gap in our system that exists to this day, and the Senator's proposal moves us in that direction. And that is to divert individuals who do not need hospitalization, who should not be in a high, expensive emergency room into a community-based environment that can meet their needs, that they will participate in voluntarily, and that will lead them on the path to stability in the community. That's the key to now facing the huge expense that we have in our mental health system of hospitalization and unnecessary emergency room services, the jails as a mental health facility, and I might add the misuse of our law enforcement as transportation to these high-cost facilities. When Progress Foundation opened its urgent care center in San Francisco in the mid-2000s in the community as an alternative psychiatric emergency service, our major partners were the private hospital emergency rooms that were being overwhelmed with psychiatric patients who weren't getting the services they needed in the community, and law enforcement. The San Francisco Police Department was our strongest supporter. We opened an environment where people could come in for triage and assessment, then they could go to a crisis residential bed for up to 2 weeks, and then move on in our continuum of care for rehabilitation services. This is the smart approach now for California in getting control of its costs, because the cost of crisis residential is 1/5 the cost of a psychiatric inpatient day, to get a participation of consumers in our service system. They've been asking for decades to provide services that they will participate in voluntarily if we listen to them, if we construct a response around their needs. It is the way to position California to be ready for the Affordable Care Act that is going to be looking hard at recidivism, looking hard at the unnecessary use of hospitalization. Most of all, it's the human thing to do. It's the right thing to do. It's the way to go to develop a community mental health system once and for all in the state. So this is a great proposal. Look forward to seeing it move through to success. Thank you.
Thank you very much, Steve. Now maybe the most important witness of the day, Leslie Napper, who has had firsthand experience in California's mental health care system, to talk about the difference that this kind of proposal could make for others who went through what she went through. Leslie, welcome to you.
Thank you, Senator.
Of course.
Good morning. I was nervous. My name is Leslie Napper. I'm a native of Sacramento, California, a daughter, sister, proud mother, grandmother, aunt, niece, cousin, friend, and so much more. I am also a person living with mental illness, and one that frequently utilizes mental health services here in Sacramento County for over 15 years. I have received services as a private pay using employee benefits, and after I became very mentally ill and had to leave my job as an indigent person utilizing government medical assistance, Medicare, Medi-Cal, thanks in part to the Mental Health Services Act. I have resided at a private psychiatric hospital and several times at the Sacramento County Mental Health Treatment Center. Then I was referred to Turning Point's Crisis Residential. A mental health crisis for me is when I'm unable to manage my job, my time, my money, my living situation, my relationships, my mental health symptoms, my sleep, my life. Also when I miss a medication delivery, need to talk to someone, or a safe place. A crisis for me is anything that disrupts the rhythm of my life. For a person living with mental illness, even the smallest disruption can turn into a full-blown crisis. Every crisis does not require a mental health hospital visit or emergency room visit. But if left untreated, it most likely will, or worse. These are reasons why it's very important to me to work hard every day to manage my symptoms, but I need support. Support of my family, psychiatrist, therapist, my case manager, the groups I attend, and my peers. The challenge is the after business hours, the wee hours, the weekend hours. I have two options. One, I could wait it out, which is usually a very critical and scary time because it involves suicidal ideations, or I could visit the ER. For many, the only way to get assessed and gain access to psychiatric services is in the hospital emergency room. More often than not, the wait in the ER can be hours. For many people in mental health crises, days. waiting in hallways on gurneys, waiting to be assessed. It is undignified and traumatic, and one can easily decompensate. The hospital rooms are overwhelmed. They currently lack the capacity to efficiently manage the mental health intakes and need support. Again, not every crisis requires an ER or hospital visit. For me, it would be life-saving to be assessed right away. Having crisis stabilization units and crisis residential services would relieve the ER's intakes so that they may focus on those needing urgent medical assistance. And the crisis stabilization units and crisis residential services should be a large part of the continuum of care that is so vital for people like myself to maintain living in wellness and recovery with mental illness. Turning Point Community Programs Crisis Residential for me was a safe place to go when I believed I had nowhere to go and needed mental health crisis resolution. Avoiding the ER and a 5150 72-hour hold. It is open 7 days a week, 24 hours a day, in a home-like setting. They provide clinical and peer-led services that are treatment goals oriented. They also offer integrated services collaborations and a lot of community resources. I was assessed promptly, and they were prepared to refer me to appropriate care if my crisis escalated. And because of collaborations, that placement would have been swift. The staff and volunteers are reflective of the populations they serve, and they are culturally congruent, competent, and responsive. And they provide services that are innovative and hopefully lasting. Though it took several stays at Crisis Residential throughout the years, I have been fortunate that in my time of crisis, a bed was available. The need for open beds was great then. Now, with 1 in 4 Americans experiencing some form of mental illness at any point in their lives, that need is even greater. It is crucial for the health of our communities that triage assessments are prompt, and crisis stabilization units, along with crisis residential services, are able to expand their capacity in order to meet our mental health needs. Because of the care I received at Turning Point Crisis Residential, I am here speaking before all of you. I am a volunteer there and providing mental health services, and I currently live in wellness and recovery with my mental illness. I am an advocate for thousands just like me here in Sacramento County and across our great state of California. Thank you, Turning Point Community Programs, John Buck, for helping to save my life. And thank you, Senator Steinberg, for supporting and finding solutions for Californians living with mental illness to help us move through our mental health crises and live in wellness and recovery. Thank you.
Thank you. That was really articulate and really well done, Leslie. Thank you so much. So now I'm going to ask the guy who runs Turning Point Community Programs, John Buck, to come on up briefly, because he can talk, let me tell you. But really, here's the key question, because we just heard a good story, if you will. How many people are you not able to help because of lack of capacity? How many Leslies are out there that you can't help that you could help now with this kind of proposal? John, welcome.
Thank you, Senator Steinberg. I don't have the immediate answer, but I'll work on it overnight. The sad thing is there's probably lots of people out there that we're not able to help. I'm John Buck. I'm the CEO of Turning Point Community Programs, located here in Sacramento. We operate a 12-bed crisis residential program funded by our partners, Sacramento County, and have since 1991. Leslie, it was our privilege to serve you and hundreds of other folks each year with our services. In a nutshell, the crisis residential programs are a low-cost, unlocked alternative to acute hospitalization. And what that means is it helps the taxpayer out, it saves money, it's more efficient, it helps out the person because they're treated with greater dignity than being moved about in a hospital. They also feel that they can still be connected to the community, to the family, to the support system while getting support and a degree of relief. These kinds of homes are located in your community. They're average homes. They look like any other home in the community. They have some requirements because they are licensed residential programs. But the bottom line is they shorten crises and promote people's personal recovery. And that saves everybody down the road a lot, including the person. So I encourage you to and urge you to support Senator Steinberg's effort. And a final thought. We have a lot of returning veterans from Iraq and Afghanistan. They're coming back with more profound mental health issues than any other generation, including my generation of Vietnam veterans. We did a horrific service, or disservice, if you will, to our Vietnam veterans, and we have to do better by these returning veterans and their families to address their mental health needs. I thank you very much.
John, that was great. Thank you. I want to, before I introduce the sheriff, make the link here, because some of you out there might say to yourself, well, you're talking short-term stuff here, right? What about the long-term solutions? Here's the point. Without this foundation, without crisis residential, without triage, you can't get people into longer-term services. That's what's missing right now from the system. We don't have enough of the long-term services, but we have a lot, more than we've ever had because of Prop 63. But it is that lack of linkage. It's what the budget cuts have done to our ability to be able to assure a family member that if they make a phone call and need help, that there's going to be a place where their loved one is safe and where they can get the help they need to transition to longer-term service or care. I want to thank Nick Warner for being here from the State Sheriff's Association. He runs that organization, of course, and Tim Madden from the Emergency Docs. Thank you for being here. I want to now introduce Nevada County Sheriff Keith Royal, the president of the State Sheriff's Association, because unfortunately, this issue of untreated mental illness too often becomes a criminal justice issue. Sheriff, president of the association, welcome to you, sir.
Thank you, sir.
Thank you.
It's a pleasure to be here today. This is about public safety. The bottom line, when a call comes in and somebody has a mental episode and we have to have an officer respond to a call for service, they make an initial determination they believe the person is unable to care for their welfare. They transport them to the hospital, at least in our county, where then they're evaluated. If a decision is made that the person needs to be placed or have a 5150 hold placed on them, many times the mental health department searches for a bed for that person to be transported to. What this does, this officer's tied up for hours, which means, because we've all gone through budget crisis, we've all reduced our staff, that officer can't walk away. He has to stay with that individual, which means he's unavailable to respond to another emergency crisis that may occur within the community. It is about public safety. It's about public safety from the standpoint, many of these individuals are arrested for very low-level offenses. They're booked into our jails. We have now become the new mental health asylums because of the closing of the state hospitals. We've seen those numbers increase 2 to 3-fold, those type of individuals that need acute mental health treatment. But the problem is they're in on a low-level offense. Many times the courts recognize that. They're afraid to adjudicate the case, meaning the person's time served, to place them in a treatment facility because of the lack of beds. Again, it's a public safety issue. I think increasing these programs that are recommended by the Pro Tem will go a long ways to trying to reduce recidivism and also improve public safety. So I thank you for your efforts in this matter.
Thank you so much, Sheriff. We appreciate it. Now let me ask Carol Menel, who is a practicing emergency room nurse at Mercy San Juan Trauma Center. She's been in this business now for over 30 years. And she started very young, by the way, and has seen it all, and is very active as a leader among other emergency room personnel to try to create a better system here in Sacramento. Carol, welcome.
Thank you. Thank you. I'm Carol Manell, and I have been a registered nurse for over 30 years. I work for Dignity Health. Please note the name Dignity. I work in emergency services, and in emergency services we dedicate our lives that when you come to us with your emergency, we make sure that you get the appropriate care and that you're in the appropriate place. And we can do that if you're having a heart attack or if you've been in trauma. With the mental health patient comes to us, we are not the appropriate place. Sometimes our mental health patients are waiting for 3 days in the emergency department, in a gurney, in a curtained room, getting only the basic needs. They are not getting the appropriate care. My co-workers and I are sometimes subject to violence when we can't get the correct treatment for these people, and they are not being treated with dignity. I want to thank sincerely Senator Steinberg for listening to our silent scream. He has finally turned on the volume, and I want to thank you, sir.
Thank you. To bring it home here before we answer your questions, again, the chair of the Legislative Mental Health Caucus and the Senate Select Committee on Mental Health, a real champion who feels it, believes it, breathes it, knows it. Senator Jim Bell.
Thank you. And you know, there's a story that people tell that work in mental health that when somebody has cancer or they have a heart attack on the street, people rush forward to try to help that person. But when somebody has a mental health episode on the street, we all kind of stay away and we observe and we like to watch it. In fact, now we have sort of this reality TV thing that we're sort of like, we like to watch people have mental health problems. And that's a sign of our vicarious moral ineptitude that we have in our country. And we have to get rid of the stigma of mental health by having government leaders that rush forward and try to help. And that's what Darrell Steinberg, I'll say, has been doing his entire career. He's the one guy that's been rushing forward. And California needs a new way. They need a new way to deal with the prisons, a smart way. This is a smart way. It's a fiscally responsible way. Every dime that we spend on health care in California comes out of the state general fund. And it gets taken away from education. Higher education loses every time we fail in the recidivism. So we need a new way, and this is a new way. This is why this is a smart way to spend money. It will draw in more federal funds, and it's the morally correct thing to do. So I urge your support for this, and turn it back to my leader, Senator Steinberg.
Thank you very much, Jim. We're happy, any of us, to answer your questions. Certainly any of the speakers here can talk about their experiences in the ER and jails in the programs themselves.
Senator, with regard to prison overcrowding, you've
Yeah.
heard the plan that was submitted last week by CDCR, a plan that does not have a lot of support here in the legislature. How specifically would your plan that you've outlined today help reduce prison overcrowding?
I knew that would be the first question. It's an appropriate question. Is this in response to the governor's plan? I guess the answer is yes and no. No in the sense that it does not propose significant increased funding for mental health within the prisons or jails themselves. I think that is needed as well. And maybe as part of the budget negotiation, that can be added to the that can be added to the list of items to discuss and to resolve in a positive way. Yes, because I believe that ultimately, if we are going to reduce overcrowding over the long term, we have to provide more effective, cost-effective ways to keep people who leave the prisons and the jails from returning. And the statistic that I spoke to earlier, I think, says it all. The Integrated Services for Mentally Ill Parolees, a 3-year project, 1,500 people. The recidivism rate is 24% for those people, compared to a recidivism rate of 71%. The vast majority of people who enter county jail or state prison under realignment, with or without realignment, are going to leave. And they're going to become part of our communities again. The question for us is, are we going to do everything we can that is reasonable, that is cost effective, that is consistent with public safety to ensure they don't go back? This is a solid investment. Now, whether or not it's responsive to the 3-judge panel or not, I don't know. I think it should be, by the way. I think it should be. Because, you know, the other thing that I will say is that, and I obviously have great respect for federal judges. They're very powerful and important folks. They don't have the responsibility to make budget decisions. They don't have the responsibility to take limited public resources and decide whether it is more cost effective to keep people from returning to prison or jail by investing in mental health and substance abuse and vocational assistance than it is to spend it on some of what they're calling for. So I think that this adds to the debate in a significant way, but I have no illusion that it is going to satisfy the 3-judge panel. I think it's important on its own. Corey?
So you mentioned a couple of different possible funding sources.
Yes.
What's the total estimated price tag?
We are still costing it out. We are still costing it out, so I don't have that. But it will be reasonable, especially when you consider that we can draw 100% federal funding for people who we sign up for the first time for health insurance, the so-called newly eligible. We have some foundation money that has already been committed. We have Proposition 63. And we have the State General Fund. And we want to minimize the amount from the State General Fund, but I'm not going to be afraid, especially if there is a surplus, to suggest that a modest investment would be a great investment for California.
Senator, the 3-judge panel is looking very closely at numbers here. They wanted 10,000. The CDCR came up with about 10,000. CDCR came up with about 7,000. And it seems like you're hoping this might be used in conjunction with that. Do you have an idea of numbers? What you think this could lead to in terms of reducing the prison population?
Well, I know that it will reduce the jail and prison population over the medium to long term. I don't know whether or not this is responsive to the 3-judge panel, and that isn't the point. It happens, we've been working on this for months. And as I said, really there were 3 driving forces here in terms of what's happening in society today. Newtown, Nevada, and the 9th Circuit. And the 9th Circuit, the court issue with corrections is one of the reasons, but it's not the only reason. Like I said, I'm open, and we're going to talk about this in caucus today, about also trying to put more mental health services into county jails and into the institutions themselves. But this focuses on keeping people from going in the first place and keeping people out once they have left. Dan?
2,000 beds, what would the length of stay be? Would they be IMDs?
There'd be 2 levels, really. Crisis stabilization is really 24 hours or less. Crisis residential is up to 30 days.
Most high-end 2 weeks, but up to 30 days.
2 weeks to 30 days.
And they're not IMDs.
They're not.
No, they're fully Medi-Cal reimbursable, because the model envisions program. The model that has been extant in the state that has been so successful are 16 beds and less, so they no longer meet the IMD exclusion. So the other leveraging of the services in these programs comes from the Medi-Cal capability, and that's a significant part of it.
Are they locked facilities?
No, they're not. They're voluntary facilities. But let me give you just one example. In San Francisco, 4 years ago, we had over 80 acute inpatient beds in our public hospital. We're down to 20 now, 22. We have 4 operating crisis residential programs in that city that take people only out of the San Francisco General Emergency Room. So all of our diversions are people at that point of either going into a hospital bed or being diverted. And that's where we get all of our clients in San Francisco. These models are designed to divert from the unnecessary use of locked facilities.
And here's a statistic for you. between 1995 and 2008, I'm sure it's gotten worse since then, but this is the most recent data, California has lost 42 psychiatric facilities and 2,816 beds. 25 counties have no psychiatric beds. Questions?
I'm sorry.
Go ahead.
The new facility opening up in Stockton, will there be services there that address some of the things you're talking about here today?
Yes, but those are for inmates. Those are for inmates. And so, yes. And that's part of the governor's point, which, you know, I want to say, because I've said it a couple times, I want to be clear. I basically agree with the governor's position here on how he's handling this. Because he has made the point, and I agree with him, that realignment was a huge step towards reducing the prison population. It has been a tremendous challenge for the counties and the county sheriffs. And there's some pressure, obviously you see some of the bills in the legislature, to kind of go back the other way. Now the three-judge panel says 9,000 or 12,000 more, 10,000 more people. The system has all that it can handle right now. And so maybe by getting out of this lose-lose kind of an equation where you're either releasing more people early or you're spending a lot of money to build more capacity, we ought to invest in what everybody agrees on: more mental health treatment, more substance abuse treatment, more vocational assistance, to keep people out of these systems in the first place. And if they've entered the criminal justice system, when they get out, to do everything we can to make sure that they don't return.
Could you elaborate more about how this effort can help to prevent violence at massive tragedy?
Well, one of the things that we know is that early treatment of serious mental illness leads to better results for people. And we know through Prop 63, frankly, that we have a number of programs in Los Angeles County. For example, there is a program where law enforcement works with the high schools to identify young kids whose behavior is either off or who have said something that the school officials consider a threat. And they get them they get them the help they need, and then they of course watch them and make sure that they're better and that they're not a threat. In Sacramento County, we've got an early psychosis evaluation program where a couple thousand, I think it's 1,200, excuse me, young people between the ages of 12 and 25 who, because of family history or because of behavior, are going to UC Davis and they're getting an early mental health evaluation, and when there are signs, they're getting help early. And so all of those kinds of approaches, including this approach, will reduce violence because people will be getting the help that they need early. We always say we don't associate mental illness across the board with violence because the vast majority of people with severe mental illness do not commit violent acts. But there are those who do. And if this can stop another Newtown, all the better. Yeah.
Well, you said that this proposal won't necessarily satisfy the Ninth Circuit.
I don't know.
At least on its own. You said that you might support the governor's plan, but it doesn't have.
No. I said I support the governor's direction to appeal to the Supreme Court.
Okay, gotcha.
We're going to be meeting with our caucus today on some of the specifics. I mean, for example, on the good time credits, I'd like to know who we're talking about here, who this population is. I have some, I'll speak for myself, not for Jim. I have some serious concerns with that part of the proposal. I think we're already pushing a lot of people out. I'm sure the sheriff would kind of agree with that one. And then on the jail capacity issue, you know, I don't have a policy problem against it, but I sure have a fiscal concern, especially if we have a limited amount of dollars, and we have a choice whether to put it into this kind of an approach or building more jail capacity. Again, might disagree on that. I don't know, but. So I have concerns with all elements of the governor's proposal, which we all know he made under protest. What I agree with is his appeal, because I think the courts ought to let this good governor, who is managing the prisons now well, in my view, have a chance to to take it back. That's what I think.
But I guess my question is, what should be done? What actions does the Senate support taking, or do you support taking in response to the court order, setting the appeal aside?
No, I support the appeal at this point. We are not ready to jump into more early release or building more jail capacity. That's my opinion. I'm going to take it to my caucus today, and we're going to hear from them. So, I mean, there are a few things on that list, like expanding the fire camps, which seem reasonable. There may be some things on the margins here, but fundamentally, there's a real impasse here. Now, maybe this is a third way, combined with more investment for mental health and substance abuse in the jails and the prisons. I don't know. I didn't come here today, like I said, this has been planning for a long time. If to make the oral argument before the Ninth Circuit here, but happy to volunteer if they need me.
How would the mobile centers be? Oh.
Go ahead, Julie, and then I'll get back to you, Tori.
How far are you willing to go on pushing back on the prison population cap? Because the court's, at least CDCR's interpretation of the court ruling was that anyone who gets in the way of making it happen could be held in contempt. The legislature could be held in contempt. Individuals could be held in contempt. And the worst, I guess the greatest risk is if you don't do anything, then the court may act separately.
Well, they may, and I think we have to continue to be in close consultation with the executive branch of government, not act in a rash way, just continue to be thoughtful and collaborative with the governor. But look I have a constitutional responsibility, as does Jim Bell, as do my colleagues, and that is to pass a budget by June 15th. Part of that constitutional responsibility is to assess priorities and to make judgments about where limited public dollars ought to be spent. I'm saying I want limited public dollars spent on this kind of approach, not on the kind of approaches that are being talked about in that other venue. We'll see where it goes.
The mobile centers, where do you envision them going throughout the state? Would it be based on population or areas that have had beds closed and mental health facilities?
Yeah, what we will do is we want to set up a grant structure, if you will, $500,000 grants per project, not per community, because Los Angeles, for example, we hope we'll get more than $500,000, but per project, to basically show what you want to do, whether it's mobile outreach, whether it's triage, the number of crisis residential beds, and then we'll endeavor through the right executive function to get those dollars out as quickly as possible. Thank you, everybody. Got another? I'm sorry. Wyatt, I'm sorry.
What's the vehicle for this? Are you planning to do this through the budget, or is this?
Well, I have a bill. What is the bill? SB 364 is a bill, but we plan to do this. We plan to raise these issues in the budget.
Thank you.
Okay, thank you all very much. Appreciate your coming. Thank you.